Hi everyone and welcome to ABCs of Anaesthesia. Today I'm with Dr Meg Shaw. So Meg has done so much work for ABCs of Anaesthesia. She delivers a lot of our final exam content, the med vivas and investigations as well as ECGs. But most importantly, she won the prize for the second sitting of the 2023 final exam. That's our Australian exam, our specialist exam, which is an incredibly challenging exam with just a lot of work and a lot of ways that you can do better to increase your performance. So, hey, welcome, Meg. How's it going?
Yeah, good. How are you?
Really good. I think the reason we did this was so many people asked you just for tips and just how to get started and how to structure your exam preparation. So, yeah, I think there's a great opportunity just to talk about that.
Yeah, no problem. It's also like so many people helped me when I was preparing, so I feel like I should, give back and the pass it forward kind of principle.
I love that. Yeah, pay forward. I think that's the same thing. I think we all stand on the shoulders of all the people before us, and I remember just so many people who gave me tips and people who gave them tips before them. And it really takes a whole department and a generation of anaesthetists to, help each other learn and get through this exam. So,
and you gave me lots of tips when I was preparing as well.
Excellent. Love, great to hear that. Maybe the things we'll go through is things like planning your study overall, exam-specific type tips, specific SAQ or short answer question techniques, MCQ techniques, thinking how to think about the vivas in multiple ways, and then just anything else that comes up along the way. So let's get started. So Meg, how did you plan your study overall?
Yeah, so something I really noticed when I was preparing for the first part is I found the whole process super duper stressful. You go through medical school and you feel like, all we do is study and sit exams and, in all the way up to get into medical school, even all we do is study and sit exams. And so you kind of feel like, I know how to sit an exam. But I think something that experience of the first part really taught me is that I actually didn't know how to work full time, take on a registrar role, learn how to be a registrar and study full time. And so when I approached the second part, I wanted to do things differently. And so I actually saw a performance psychologist to help plan my study. I saw Patsy Tremaine. Her whole business is doctors sitting exams, so she really knows what she's talking about. She actually used to be an Olympic diver, so certainly knows how to perform under pressure. And her sub-interest is the anaesthetic exams. She's, actually advised exam committees and things like that within ANSCO. Her books are on the website and the exam preparation thing. And that really helped me plan my study. I really took on some of her tips and tricks, and I found that I studied less hours, I studied more effectively, I studied for less months overall than I did for the first part. I didn't win the prize for the first part, and I found the experience really stressful, whereas I had a bit of work-life balance for the second part. So that's my first big tip is, really plan your study with someone who knows what they're talking about, and, any performance psychologist, you find that suits you, but I found her absolutely brilliant. That's amazing. And I think so we recommended her on a couple of different podcasts with the SIMG, so the Special International Graduates, and I read part of her book and I thought, I remember how ineffective or inefficient my study was, even though my first class study was so inefficient.
Yeah, exactly. Like I would take a whole Saturday and I think the first few hours were really productive, but then just the fact that it just was me sitting at a computer pretending to study, and just from the guilt of trying not to leave my desk. So I kind of wish I had Patsy Tremaine back then. She goes through some specific things, but what do you think about besides the performance psychology part of it, how did you do all that pre-organization?
So one of the things that I initially did before I saw her was I had my whole study calendar planned out, like we do from the Mac 95 stuff for the first part, where, this few weeks is going to be this topic, and then I'm going to change to this topic, and then I'm going to change to this topic. After I saw her, I actually changed that approach. So my study was not, this week I'm doing, cardio rest, or this week I'm doing neurosurgery. I was changing topics regularly, but I still had, how to describe it? It's like an Excel spreadsheet of a visual representation of how, quote unquote, large the topics were according to the number of LOs, or I devoted more time to things that I thought I actually hadn't done that much in my training. So I hadn't done that much regional, so I needed more time to study that.
And just with that, so you jump between topics as guided by the short answer questions and things like that?
So within a single study session, I tried to not spend too much time on a single topic. So I changed in order to keep my interest and keep my my engagement.
And how did you did you have a system of ticking off when you'd completed I guess, all the syllabus points of a topic.
Yeah, so I had in my OneNote the learning objectives, so that I made sure I went through that. And then on my, like, that visual representation I was talking to you about, I color-coded things. So if I had not studied it at all, it was white. If I'd studied all of the yellows, it was dark green, and then sort of shades of green through there, because I thought green was a nice, relaxing color. That's no other specific reason for green.
Okay, that's good. So that's how you were preparing for it. In terms of collecting resources, yeah.
Sorry, that was the question you asked me before I went off the tangent. So I got notes, other people's notes from years who'd sat, who I thought had probably engaged well within the syllabus and passed well. And I used some of their notes as a springboard for my notes, and then I wrote some of my own notes as well. So I'd have a bit of an idea of how much detail people who'd sat this exam before had gone into on individual topics, and used some of their resources, and then wrote my notes using some of theirs as a scaffold, and then some things I just wrote my own notes.
I did the same thing as well. I thought, if you just have someone's notes, you haven't actually anything. It's not active learning. So all my notes were absolutely annotated to make sure that I had really synthesized it.
Versions of other people's notes. Yeah,
good. And
a few different sources of them.
Just to put it out there, so some people might be more, remote or not have the access to certain things. So if they are, please comment in the notes or send me an email, and I hopefully can link you up with someone who is from a major hospital who has access to notes. I think just having that equity of access is really important and can really be a struggle if you're in a rural program or an SIMG. So
I also think my notes are floating around there. I've shared them, and I'm very happy for people to.
Oh, good, excellent.
It helps, and I still update them, so it helps me stay current as well.
Yeah, amazing.
Yeah.
Is there anything else about the way I know I talked about in the primary exam, at least, you got to just set your life up in a certain way, whether it's having a cleaner or your favorite restaurant and the takeaway menu, and get your taxes done, organize the rest of your life, maybe exercise as well. How did you do that?
So I think in the first part, I definitely turned into a desk potato, where all I was doing was either working, studying, and a bit of sleep. And I didn't find that was efficient at all. So with the second part, I had a fitness program. I think I was the most fit I ever have been and probably ever will be when I sat the exam.
I definitely lost fitness. If I do exercise in the day, that's me done for the day. Okay. So I got really unfit. Anyway, back to you.
Well, I'm really unfit now. But that actually helped me, I think, stay more efficient. So having an easily accessible means of exercise, for me, it was just like an online workout program. Having, good food. I fortunately have a lovely husband who loves to cook. I burn everything. So, good nutrition and, a reasonable amount of sleep as well, I think makes the study itself more efficient. And you sort of just I had to really push past the guilt of not, being that desk potato that I was for the first part. Yeah,
just remember, you don't need a partner. You just need a really good, healthy-ish restaurant.
Or dinner ladies. Dinner ladies is what I use now. I've
never heard of that.
It's just an online food ordering thing.
Amazing. Okay.
Meals. Yeah, it's good. It's pre-prepared meals. You just hit them up.
And just ladies.
Yeah. No, they deliver to men as well.
I was thinking about the preparation. Okay, so that's good. So we, exercise, food prep. It's that point of just lots of 1% gains, or the collective of marginal gains equals something bigger. So making sure that you're sleeping well, exercising, food,
good desk setup,
really, really helps. And then the other thing we just mentioned was to have that organization. So you had an Excel spreadsheet with all the LOs. So you literally
So I had all the LOs in my OneNote. I love OneNote because you can see all of your notes and you can see how things you sort of link, and it's all there in front of you rather than opening individual Word documents. But then I had an Excel spreadsheet that had boxes that were, the size of them was relative to how many LOs there were, or if it was something I thought I was going to have to spend more time on, like regional, because I haven't done all of that much regional in my training. And then I would color code them according to whether I'd covered the topic or not and how much of the topic I covered.
Amazing.
So I tracked the LOs in the OneNote, and then I had a big spreadsheet that I would open up and go, oh, well, actually, I've not done stats. Even though I'm changing between topics as to, what piques my interest in this moment, at some point you've got to do the stats. So that kind of kept me honest to a sense, if that makes sense.
And just remember, you may not be the most organized person, which is hopefully not the case, but if you're not, hopefully you've got a mate or some colleague who's done that. So you don't have to all double up, and hopefully you pay it forward in other ways. So someone does that OneNote, or someone collates something else. But either way, you can kind of share.
I can send you a version of the spreadsheet, so we can put it up on ABCs and people can see what I mean.
We'll definitely do that. I'm just going to pause there and just check the recording. One of those worst things of the recording actually not being...
Yeah, that would be awkward.
Yeah, so tell me about study groups.
Yeah, so I had a study group. I studied with 2 other people. Both have become like great friends of mine. And I think the things that made our study group work is that we all had similar goals. We were all sitting at the same time, which I know some study groups, people are sitting at sort of different times. We'd all started preparing from the same point. And I felt like it was a no judgment kind of space. So we weren't competing with each other. We weren't sort of trying to, prove that one of us knew more than any of the others. We were really supporting each other, and we shared our notes amongst each other, but we had our own individual notes. And then we were pretty flexible about when we met up, because we, everyone's working shift work. You can't, if you say, oh, it's, a Sunday morning at 7 a.m, someone might be working at that time. So we were relatively flexible. And we mainly did Zoom study rather than in person, because it just worked better for us.
Okay.
The other 2 people in my group had young kids, so I sort of tried to work around them.
Yeah.
So having a degree of flexibility in the group, I think is helpful, and people of similar life stages and goals.
Okay.
Yeah.
A lot of people divide, I guess, questions or topics. I always find it that you actually have to go through everything. Like,
yeah,
what
we
you
did.
do.
So we didn't really divide stuff,
No.
but we would go through past MCQs together and say what we thought, the answer was.
Okay.
Or yeah.
And what was like? Let's say on any given study group session, what's the mechanics of it? How many hours are you studying together? What are you covering? How are you covering it?
We mainly went through past exams together, or like past SAQs or past MCQs as the focus of our topics.
Right.
And then if we had individual questions about a study area or something like that, one of us might put in our WhatsApp group. We had a WhatsApp group. Hey, what do you guys think about, hyponatremia, or what do you think about peds murmurs or something like that? And then someone might say, oh, actually, I covered this yesterday, or I covered this last week, and then send their notes through. And then those 2 individual people might have a chat about that topic and then continue on from there. But group study was mainly about, past papers.
Yeah, okay. And that was the same as me. Like, I felt like the most difficult thing was doing active learning, because it forces you to get out a paper and put pen on paper. And that's just really exhausting sometimes. So to have someone coming over or on Zoom and saying you have to actually write some stuff out is just absolutely the way I did it as well. And just a bit of a plug for, study groups can be many different sizes, many different ways can work. So, if every now and again you hear of someone being completely isolated. So if there's people out
you
there.
have to have a study group, I think.
Yeah, exactly. And if you know someone who doesn't have a study group, having that one extra person is just not the biggest deal. So please, keep it welcome. Because, at any given stage, people can't always turn up and attend. So just be able to have it more inclusive means that you'll, learn from the fact that that person who even isn't in your hospital, but has, a consultant there who gave a particular vibe or gave a particular resource, or they did a particular case. So just having the breadth of knowledge of a larger group is not the worst thing, because eventually, you all have to do the work anyway.
Yeah. And I think what you said there, sometimes one person can't attend. Having at least 3 is really helpful from that, because if one of us couldn't come, then the other 2 could meet up, and and that was really helpful.
So we're starting to cover the individual study sessions. In terms of that's the study group session. Is there anything else about study groups?
Trying to think that there was something else I was going to say. Can't remember what it was. Obviously, you'll cut this point, but
No, I won't cut this. This is us remembering.
Just remembering. Yeah,
It's
not
real.
brain. Like occasionally I think some person, marking each other's SAQs.
Yeah.
So what you mentioned about active learning, I think is so true. And I think we'll go into that in the individual study sessions. But I think the majority of what I learned was from testing myself. And sometimes that's soul crushing, because you test yourself and you can't remember anything. But you've really got to put that ego aside, because that is what will help you help you learn. And because it was it was a really great no judgment space. If, I wrote a practice SAQ and I could send it to one of the others and say, hey, what do you think of this? And then they might say, oh, I did that SAQ 2 days ago and this is what I said. Let's compare answers, or, mark each other's SAQs. And it forces you to do it more and really reflect on what you've missed or what or what you've done well, by sending it to someone else. There's not always a consultant available for you to send it to, or you might not feel, comfortable doing that initially. And so having someone in your study group to send that to, I think can be really helpful as well.
That's such good advice. Like, to send it to one of the consultants who's already passed the exam is so tricky, because I know from being, depending on how many years after the exam, or even if you're immediately after the exam, it's so difficult to have a sense of what the examiners want. So the fact that you probably don't know much more than what the examiners have written on their final exam report. So just to have people interested marking things is great. And I know that when I first started, my SAQs were terrible.
Everyone's it.
Yeah, just totally accept that, right? And just the fact that you can compare, comparing notes is extremely useful.
And even if they can't necessarily mark it for you, they might have another angle of thinking about that question that you hadn't thought about, and then that'll broaden your understanding of what it might be wanted, and also just forces you to do more of them if you're actually sending them to each other.
Yeah, and one of my trainees did a lot of reading of topics, listening to topics, but the fact that they're not actively putting pen on paper was, I was just said, look, you can't keep doing this. You have to be writing SAQs.
Yeah.
Otherwise, you're just prolonging the
inevitable. You're not practicing game day.
Yeah, you got to prepare for game day. Yeah, that's right.
Because you're not just assessed on your knowledge. You're assessed on your ability to communicate that knowledge in a concise, but also comprehensive. So somewhere finding the balance of concise and comprehensive in a particular time frame. Even the muscular strength and fatigue of handwriting for that long. So I think you got to be practicing putting pen to paper.
Yeah, absolutely. Okay, so that's study groups. Let's talk about your individual study sessions.
Yeah.
How did you organise that?
So I guess from a whole week perspective, on days that I worked, I would come home and do active recall. I wouldn't try and learn something new, because I don't know about you, but after a long day at work, it's hard to actually come home and learn something new. Yeah. Whereas I think it's much easier and I think more effective for me in that time frame to go, okay, I'm going to sit down and I'm going to do an MCQ paper, or I'm going to sit down and I'm going to do some SAQs on topics that I've done some reading on already, or I'm going to go through my cards of active notes that I've made, which I guess I can talk about now. When I was learning new stuff, I would write down, oh, actually that's, a really important point. And, what are the grades of shock, or, what are the different types of peds murmurs, or, what's the treatment for anaphylaxis? And then I'd have a short kind of answer to that, and I'd test myself on those things when I got home, because those were high yield things that you just sort of have to have roll off the tongue. And I'd do that on a day that I'd worked. On a day that I wasn't working, or I was only working in the afternoon, so I had the morning quote unquote free. I mean, you're never free when you're studying for an exam. Then I would devote that to learning new stuff.
Yeah, okay.
And that would be in 50-minute blocks. So 50 minutes of, head down, no distractions, of, actually learning new content, and then a 10-minute break where you get up and you leave the desk to get the blood flowing and not be the death potato that I was in the primary.
I wish I did that. Yeah, 50. This is what Patsy Tremaine has in her book as well, if you don't know. But 50 minutes on, 10 minutes off.
I didn't think of it myself. It was from
no, that's right. Credit where goes to you. And that's, I think if you have the time, you do that for 4 hours. So 50-10 times 4. What did you do in the 10 minutes off? Because this can be a real trap for people, I think.
So get something to eat if it's time to eat something. A glass of water, go to the bathroom. Or other times I would just do a lap around the block so that I'm getting some fresh air and,
Yeah, I would say I did this the wrong way, but the wrong thing to do is to get on YouTube or watch any kind of, it's so easy to go down a rabbit hole. So going
and I set a 10-minute timer.
Oh, good. Yeah. So being absolutely, militant about that is really useful. I do the same thing. So I knew that I didn't want to learn new things. I tried to learn as much in the morning, because my mind is sharpest in the mornings. Even if I'm on a case, if it's a long case, I can just read up about the case, and that's useful. And after work is when I just, my mate would come over and we'd just do SAQ after SAQ.
The 50-minute blocks, I might do one topic in that 50-minute block and then change to another topic in the next 50-minute block. Or if it was a particularly dense topic, I'd stay on the same topic as long as I was honest with myself that I was still engaged with the content. As soon as I, started to get fatigued with that content, and you change for another topic, it's kind of like taking, a shot of coffee. Suddenly your brain re-engages and you're doing effective study again. I would choose topics based on what I was interested in or hadn't covered, or if I'd seen that particular thing or topic at work, then I would study it because I knew that I could link it back to a case that I'd just done, and that would stay in my brain better.
Oh, good. Oh, that's really interesting. So, so if you're studying, why not just do the thing you've just done? So now you've got cross-linking the neurons and you're extracting that.
So I did a bit more peds study when I was doing my year was specific peds and specific women's and adults rotations, which I think I was very privileged to have that. But when I was doing peds, I was studying more peds. When I was doing women's, I was studying more women's because I knew it would stay in my brain better.
Excellent.
Intentional staff, recent vet, adult, 15, bed 7, treating team, infectious diseases.
Just stop that one. Good. I love this point. So one of the other points you've got here is test before reading the new topic. How did you actually...
So again, credit where credit's due. This is a Patsy thing.
Love it.
So this is it's hard because you don't want to get sort of, it can feel a bit bad to test yourself on something and not know anything. Like we all admit that, right?
Yeah, absolutely.
But if I was doing a new area where I knew that maybe I knew something from, the dredges of my mind in medical school or, things that I'd seen, but I don't know the detail of it, I would go and find an SAQ on that topic. I'd give myself 10 minutes to answer that SAQ, write as much as I thought I could write on that SAQ. Obviously, you're going to, or at least I didn't do particularly well on those SAQs. And then you kind of put that aside and you go and you read around that topic and you make your notes or you edit someone else's notes, you annotate someone else's notes, you make your active learning cards. And then you come back and you try and do the SAQ again. And I found that because I'd be like, oh, I should have put that in the SAQ. Oh, that's a really good point. That would have answered that SAQ much better. Oh, I got that wrong. And then because you've gotten it wrong, it kind of sticks in your memory a little bit more. And then, I found that was much more effective.
That's beautiful. It's almost like
testing before you even studied it.
Because then it's like if you test after, you might just feel crap about the fact that you've forgotten stuff. But if you test after already doing not a great job, you're like, I've learned so much.
Oh, yeah, that's true. Yeah, that's another way of thinking about it. But I also, having made those errors, I think, or missed key points or gotten key points wrong, you then you read the content and you link it back to the SAQ you've just done poorly on and you remember it a little bit better. Yeah.
What I'm hearing as well, it's almost like ego is the enemy of learning. Like if you have any ego in this at all, like you're an advanced trainee and obviously you should know a lot of stuff, but the fact is you haven't studied at this intensity. So there's just no way you're going to recall things and know the detail and you'll feel so, this is like an amazing exam for, once you've passed it, you feel like you've really passed a hurdle. And the fact that you had no ego about it is probably the best thing, and hopefully a good lesson for the rest of your life because you never stop learning either.
Just acknowledging that is difficult, sending someone an SAQ that you've performed badly on because you want the feedback, because you want to get better. You sort of think, oh gosh, what's that person going to think of me? Are they going to judge me as a doctor? At least I certainly felt that way. But then when you can send them an SAQ 2 months later that you perform much better on because you got that feedback, I think, is a really sort of, it's a way of getting through the content and actually learning it and remembering it a lot better. Yeah,
that's excellent. Last time, I think we've covered a bit of this, but exam-specific practice. Do you want to talk about that?
I guess I'd say that one of the things that stood out to me comparing it to the primary is that in the primary, you look at a primary paper, at least when I sat, and there'd be like five questions that were straight recalls of previous exams, 5 that were just sort of rephrasings of previous exams, and 5 that are new, right? So 2/3 of the content you've probably seen before. That sort of didn't seem to me to be true in the second part. Themes would be repeated, but individual SAQs didn't seem to be repeated.
And that doesn't mean you don't do SAQs because you have to.
Yeah. But I think doing the SAQs sort of serves 2 purposes. One is, practicing answering an SAQ. How do I put this amount of content down in this amount of time? How do I do that? And what kind of level of detail do they want? What kind of degree of breadth do they want? What structure do they want to this? So there's that purpose, and then the themes are repeated, and particularly themes that may have been answered badly in the past. So when I was studying for the first part, people seemed to study according to the SAQs, whereas I think in the second part, you've got to study according to the LOs, but do the SAQs for those purposes that we've talked about.
That's really interesting. What was I going to say? what I found that, the advice I'd gone directly before my exam was it's not worth doing SAQs because they're not repeated. First of all, that's incorrect because occasionally they're repeated, but the fact that the themes and the styles are repeated, the fact that once you've got practice, you're not thinking about what's the style of answering this question. That's such a big deal.
Yeah.
The fact that you've got the energy and the endurance in your hand as well, such an important thing. So if there's anything I can just implore for everyone, you better be doing SAQs. And the way I used to change it up is I'd do 10-minute questions, or I'd just do 5-minute questions or 3-minute questions.
When you did your 3-minute questions, what would you put down?
I'd get a lot down in 3 minutes.
But would you put headings down? Would you put details down?
Headings.
What did you do?
Headings, and even just like say something was a table, I'd be, table format, this is the table that would be inserted here. So I've actively thought of the thing I'm going to put there, even though I didn't put the detail down, knowing if I had time. So, I could get pretty much a full answer in 3 to 3 minutes, definitely in 5 minutes. And that extra 5 minutes was just extra content and making sure my writing was neat enough, I'd say. So you can get a lot of work done in 3 to 5 minutes, and it just changes it up. So you're not always doing 10-minute questions. But otherwise you have to do 10-minute questions because you need that endurance and need to actually practice getting all the data out.
So I would do the 3-minute and the 5 minutes as well, but I would play a game with myself called the 5 thing. I called it the 5 things game because I'm not particularly creative. It's a game where you think of 5 things.
Love it.
What are the 5 things that I have to get down on the page to answer this question? And then, so they're not necessarily headings or tables, but if there's a question, about the anatomy of something, well, I've got to get, the surface anatomy, the ultrasound anatomy. And I would put that detail on the page of the 5 key points of detail that I would need to answer this question so that I'm practicing detail and content rather than headings.
Right. That's really good. And if say a question is, generally these questions are broad questions, so you have to put a lot of data down. There's the usual stuff and the kind of the critical issue point of difference stuff. Did you always favor, this is what's most important, and put maybe one summary statement saying this is what's critical about the situation?
Yeah, that kind of thing. So if it was what distinguished the case from an ASA1 lap collie, it would be relevant. If it didn't distinguish it from an ASA1 lap collie, then it's not relevant. So, answering, I would put a blood pressure cuff on this patient. That's kind of a bit of a facetious example, but that being the point that that's not different from an ASA1 lap collie.
Yeah, great.
Or the questions, how would you assess the airway in this particular person? And let's say it's a penetrating neck trauma. I wouldn't include, I'd look at the Milton Patty, for example. I would include, I'd see what zone of the neck it was in, or I'd see if the wound was bubbling or something like that.
Yeah. Would you make mention of the other stuff? I'd do my standard airway assessment. What's most important is this?
Not in those words, but I suppose. So it might say, the airway assessment in particular would include. Yeah, good. Yeah. And so that's good to know, because there'd be times that you wouldn't actually mention. If they said, what's the airway assessment of this particular patient with neck lesion or whatever it is, you'd go, look, you'd say my airway assessment in particular would feature this. And you may not mention thyromental distance or Milton Patty. And that makes a lot of sense. I think my gamble in that situation was I would say usual assessment just because I would hate to miss out on marks. It's like a cognitive block.
If I was an examiner, I'd be like, of course this final exam, ATY2 knows what those things are.
So I suppose, having read some of the previous exam reports, it said things along the lines of, there's a bit of negative marking, is my reading of it. Which is if you're saying things that, if you're saying the least important thing first, or even the third most important thing first, it shows a lack of perspective. Or if you're focusing on things that are sort of really, I can't quite remember the phrasing, but if you're focusing on things that are sort of really obvious, then it might show that you don't see the crux of the issue. And so that's why I chose that phrasing of, in particular, I'd be interested about.
That's good. Because even then, if you have mentioned other stuff, the fact that you're saying this is actually what's most important means that you could have mentioned other things if you did. But they would still know that you know how to prioritize this. So, hey, that's probably a point to really emphasize. You got to think what is most important about this, and
that's why the five things game. So what are the 5 things that must go on the page for this SAQ? The 5 most important things, so that they know that, sure, there's maybe 50 things you could mention, but they know that you've only got 10 minutes, that you might only have 9 minutes, depending upon how you divide up your answers. And so they know that in your mind, these are the most important things, even if you don't say the most important thing is, because you've put it on the page, which by definition means you think it's the most important thing.
Yeah, no, that's great. I really like that style. That's definitely not something I was aware of doing. I probably did it in another way, but I like that you've, absolutely made those 5 things the most important. You actually put here, don't do the traditional 3-minute questions, which I can imagine, because if you're just putting big headings down.
Yeah, then you're not actively recalling the content.
You know the big headings already, so you're not actually testing yourself or putting something active.
Yeah.
Is there anything, so let's go through, specific SAQ technique then.
So I suppose the 10-minute questions, what I would do is open up the booklet. I'd write a big heading per page so that I had the breadth. And then I would go write the first level of detail under each of those.
Yeah,
and then if I still had time, I'd go back and I'd write the other level of detail.
I did exactly the same thing, correct.
And the big headings, again, this is a patsy, so I feel like a broken record, but I really did find her advice completely invaluable.
Yeah.
She sort of said, if the answer is a big forest, the consultant level description of that forest is the bird flying high over the forest that can see the breadth and depth of that forest and defines that using big headings.
Yes.
The intern level answer is, the kiwi bird on the bottom of the forest that's describing the toadstool and describing, the tree in front of them, and doesn't necessarily have an overview of the whole issue.
Yep.
It's like when we've talked about questions in the past and we describe the clinical issues and the logistical issues.
Yes.
And that sort of describes that not only do you have an idea of the clinical situation, but you have an idea of how you're going to achieve your goals. And that's the bird's eye view, flying high over the forest.
And so this goes well into the sense of your big headings is your framework. Yes. So whether it's logistical, clinical, person, place, procedure, personal, pathology,
or even,
intro, post.
The big issues, that define the whole perspective of that.
Yeah, great.
Thinking more SAQ versus Viva.
Yeah, absolutely. So if they say something like, what are your perioperative issues?
Yeah.
And you go, pre, intro, post, you've done the headings, and then you can write the most important detail under each.
Yes, exactly. Okay. And so, that's how I would make sure that I covered everything in an SAQ, so that even if you didn't have time to put down the final little detail, the person marking that question can see that you appreciate the breadth of the issues at the very least, and then obviously aim for the detail underneath that.
Yeah, nice. Just remember, if you don't get that breadth, if you don't have the full framework or the full story, you can't get marks for something.
Exactly.
And it's huge number of marks then.
And even if you put down all the detail underneath the headings, if you only have half of the headings, the maximum marks you can get is 5.
Yeah.
In best case scenario.
Best case, absolutely. You've also talked about, is there a guideline or position statement? And just name it, or do you go into it?
It depends on the question. So one of the questions in my exam was, I can't remember what the command term was, but like evaluate or something like that, the role of long-acting opioids in the management of acute pain. And there's a guideline specific to that, like the Fellowship of Pain Medicine, or the answer pain subspecialty.
Yes.
And they have a specific position statement on that. So I think you've got to say, actually, ANSCA has a position statement on this.
Yeah, good.
You can give some of the detail, I think, in that circumstance, I think you need to. But then, obviously the exam kind of asks you questions where the guideline kind of ends. So, what are the nuances? What's the patient where you would use that? What's the patient where you wouldn't? Yes. So see that you're able to interpret the guidelines as well and apply them to the sort of individual patient.
Yeah, that makes a lot of sense. Name the guideline. If the guidelines are really, often very long and detailed.
You can't just regurgitate the guideline.
But you can always refer to it. Realistically, that's what most people do. But what is the essence of the guideline that you might have to follow? What's the biggest point, and what's the deviation that you might have to have?
Yeah. So is there a patient that guideline doesn't apply to? Is there a patient that it applies to in a particular way or something like that? And then I think your question is, would you always give the detail of the guideline? I think if you're naming the guideline, then clearly it's relevant. You need to give some of the detail, but that's not the full answer.
Yes. When I think of these SAQs as well, there's often something a little bit odd or conflicting or whatever. And where do you put that in the framework?
So I think, I think you've got to, that's part of evaluate, right? So how are you going to apply that to a nuanced situation or a nuanced patient?
Let's give an example. Like imagine you had, a patient undergoing a BKA, and they were on huge doses of Suboxone, and the answer was something about pain management, or even perioperative planning.
Yeah.
Like, there's a conflict there, there's a difficulty there. So
yeah, I guess you'd say that, there's conflicting interests here. Maybe the patient's morbidly obese and you're worried about obesity hyperventilation, or, and so you'd sort of outline the issues, and then you'd outline the framework that you'd apply to that patient and the specialties that you consult or get involved. I referred this patient to addiction medicine post-operatively if they're on Suboxone because of an addiction problem.
Yes.
I'd refer them to the acute pain management service. I'd use these adjuncts, and then, the patient might go to RCU post-op or something like that. So the framework that you put around it, and then you'd acknowledge that, sure, we say that long-acting opioids in acute pain isn't, is maybe a grey zone or something like that, or, you'd outline the nuances of the position statement, and then you say, however, in this patient, something like that.
Yeah.
I think you sort of told me this when we were, or you talked, not me specifically, but
I'll take credit,
you told us on ABC's, the Viva boot camp that, the exam takes you to where the guideline ends.
Yes. Yeah.
So you need to acknowledge the guideline, but then what are you going to do for this particular nuance situation?
Yeah. The examiners, just looking at everything that they do, like I really like that exam in the sense that it's not a basic exam. Like, they really require you to stretch and make really tough judgment calls. And that's a big part of being an anaesthetist, but a big part of this exam is to make those tough judgment calls. Because trust me, when you get into real life situations, that's what we're doing. That's the hardest part of our job, is going, whoa, this patient's something, but I need to go against the guideline or modify it slightly. So,
or the guideline isn't possible to apply in this circumstance.
Yeah, exactly.
But you've got to acknowledge the guideline before you do that.
Exactly.
So acknowledging that I should do A, I actually can't do A because, and so I'll do this.
Yeah, exactly. Yeah. And so often when you're looking at these SAQs or the Viva or whatever it is, you'll get this sinking feeling potentially where you go, oh, wow, this is a rock and a hard place. If you ever haven't signed up to know, it's rock and a hard place, and I feel odd because I feel like I'm going to give the wrong answer. If you get that feeling, and you're generally a good level trainee who isn't mystified by basic things. When you get that feeling, know that that's not a bad feeling to have. It just means that now you've got to the level of that's what the question is testing, your ability to make decisions with conflicting prioritization. So that's not a problem. You're expected to do that.
And one of the worst things you can do is not make a decision.
Yeah, exactly. If you don't make a decision, if you sit on the fence in this and go, I could do this and I could do this in the SAQ when they require you to make a decision, you may have a far less mark, if not fail that, because they've asked you directly, what would you do? And you go, both are not great. I'm going to do this. These are the problems, and I'll mitigate the problems. So,
yeah, I think someone told me, like, you can say, acknowledging the risks of A, I would do B, but there are situations in which you say, acknowledging the risks of A, I would still do A because.
Yeah, exactly. Yeah. I think that's probably a lot of the SAQ stuff. I mean, neat handwriting is probably something to really...
Oh, yeah, if your handwriting's not neat, write in capitals, it's easier to read.
Yeah, and that's something you have to practice. I practice writing in print because I'm writing illegible cursive for most of my life after being a medical student. And I would test out the pens that I have, and the best pens were the kind of the felt tip ones. Anyway, just a real big thing. If you have messy handwriting, you need to practice this.
Yeah, and make sure that you print out exam paper and you practice on the exam paper.
Yep.
And sometimes writing on every second line can be helpful if your handwriting is not particularly neat.
Yeah, great. So they often double lined. So I think what one of my mates did is actually just created on Word, and then we just printed out lots of copies, went to Officeworks, copied
I found some particular books that I bought in like an online Officeworks-like store that actually had the same spacing.
Oh, good.
So I found that cheaper than printing and printing out a whole bunch of them.
I think the spacing is potentially a centimetre or more.
Yeah, it's quite large. Yeah.
Okay.
But even if your writing is really really not neat, you can write on every second line.
Yeah, good. Should we go through specific MCQ technique?
Yeah. So I did the thing everyone does, which is the Anki deck thing, where between cases or on your way to work on the bus or whatever, you do all the MCQ questions. It was valuable, but it wasn't the best use of my time because you're not training like you're going to play, right? Yeah. So after every MCQ on the exam, you don't get the answer flipped over and told if you're right or wrong. So the thing that I think was the best use of my time was I got the documents that we shall not speak of.
Oh, yeah.
Recalls. Yep.
Absolutely.
And I decided what I thought was the answer for each one of them. And then I printed those out and I would do 150 questions in 20 minutes and aim for 95% correct according to what I thought was the correct answer, what my study group thought was the correct answer. Because if you can do 150 of past questions in 20 minutes and get them all pretty much right, then you know you're going to get the recalls right on the day.
Yeah, good.
And I think you've really got to get the recalls right on the day.
Yeah, that's your buffer. That's your
buffer, yeah.
And then think of MCQ technique. You know, if you can rule out
if you're putting pen to paper and you're going, I'm actually not sure if this is the right answer, but I've got to move on. That's far more real than an Anki deck where you get know, your little hit of dopamine after each question, or your heart sing feeling after each question.
And so just remember, 150 questions. If you can get the past recalls, that's a nice block. The rest, it's still hard, right? These are really obscure questions sometimes. And the fact that you can rule out a couple out of 4, maybe it's 1 in 2 now. So now your averages go up. Like it really is percentage play.
Yeah.
One of the mistakes one of my colleagues did back in the day was, so when I had my gold standard papers annotated, and I had the annotated free papers, or just clean papers with some MCQs, and then I had a marking sheet. So I'd never use this one and cover up the side, because there's like subtle clues that you can take off. You have to have a clean paper that there's got no markings on it, and it's just the questions.
Yeah, I did that as well. So I had ones that didn't have anything on them, and then ones that had the annotations on, and I would just look at the ones with the annotations on and mark myself. Yeah,
excellent.
And also just remember that you say you got to get 40% to get a Viva, but it's not that you got to get 40% of 150 questions right to get a Viva. It's bell curved. So you've got to be within the top 60% of the bell curve to get a Viva, and that may be 70%, 80%, depends on how hard the exam is and how well performing your cohort is.
That's probably a good point to mention, that even, the MCQs do have a bell curve. I haven't really talked to someone about it, but let's, the other parts of the exam are not meant to have a bell curve, but, I can't imagine that that's such a rigorously standardized thing not to have it, because your impression of people is subjective. And there's going to be some level of curve. Again, this is not totally unofficial, but you've got to be performing well compared to the other people who've done the exam, I suspect. Well, you said only go back 5 years?
Yeah, so I sat in 2023, and I only went back to the first sitting of 2018 in terms of the questions, because I found when I went back further than that, the style was different, or the answer that was right then probably wasn't correct anymore because the guideline had changed.
Yeah.
Or the question that was asked then didn't have the same level of relevance as it would now because of a change of practice. And so ultimately I felt like I was teaching myself potentially incorrect things, and that 5 years of MCQ was, which is 10 papers, was well and truly enough.
Yeah, okay, that's good. I definitely went 12 years because we had them. In the last 2 years, the very early, the earliest papers, I remember there was 2 questions from the very 12 years ago paper, but it's hard to know if things changed. It's just tricky to actually get the resource. So
I looked at them, but I didn't study them.
Yeah, that's completely reasonable. Do you have an understanding of how MCQs are kept and removed?
Yeah, so if it's in one of the documents that we shall not speak of, but it's not in the exam report, then my reading of that is that it's been removed from the paper. And so sometimes I'd look at a recall one and I'd say, I really don't know what the answer is to this. I think it could be 2 of these things. I could think it could be 3 of these, options, or I don't think it's any of the options. And then you kind of go down a rabbit hole of spending a very, very long time trying to figure out that particular MCQ, because what if it appears on your paper? And you go, maybe the wording's wrong. And then you go back to the actual document and it's not in that list of MCQs that were asked on the day. I think that means that it's actually been removed from the paper because one answer, there was no correct answer when they reviewed it, or there was 2 options that were correct.
In terms of the MC, because now they give you each topic, is it? Or
they give you the STEM, but they don't give you the options.
Okay. So,
that may have changed since my sitting, actually. I'm not sure.
Yeah, maybe. Yeah. So either the topic or the STEM is now in the final exam report. So absolutely, you have to go through that. So 5 years, go through the last 5 papers and study those.
And I found that sometimes there was quite a big difference between what was recalled as the STEM and what was in the exam report as the STEM, and that it actually changed what the correct answer probably was. Also, so they do this thing called the R value. I think Stan had it on the Anesthesia Coffee Break podcast, but they had like an ex-head of the exam explain it, where if the MCQs are supposed to be predictive of SAQ performance. So if an MCQ tended to be answered correctly by people who did well on the SAQ and incorrectly by people who did poorly on the SAQ, then it's kept. If it's the opposite, it's usually thrown out. And if there's no differentiation, then it's sort of unclear as to whether it's going to be kept or not.
That makes sense. Okay. Then, it essentially means is it a well-written MCQ or not? It's a test for that. Okay.
Yeah.
Interesting. How about specific guidelines or papers?
So sometimes I would find that I'd look up some of the wording in a MCQ STEM, and then it would come up that this particular paper gives you the absolute answer to that question, and then I'd know that that's probably what the correct answer was. So they seem to be pulled from eminent papers or key publications, things like that.
It is probably the easiest way to know an answer is right. Just know that there's a new, there's now a new perioperative cardiovascular evaluation guideline that's going to be very examinable, and that's the easiest way an examiner can write a question. Eminent papers, guidelines, which are expert consensus.
BJA ed articles.
Yeah. Beautiful. Anything else about MCQs before we move on? If you can't find the answer, move on.
If you can't find the answer, definitely move on, especially if it's in the recall document and not in the paper. And I think there were still some that on the day that I sat, I wasn't 100% sure what the answer was because I may have found two papers that get completely conflicting answers. And a couple of those did come up on the day, those couple of those MCQs. I decided what I was going to go with on the day if it came up. And that's what I put down on the day.
That's great.
And even sometimes that was conflicting with my study mates. One of us thought it was actually A, I thought it was B. Either the other person thought it was C, and we all knew what we were going to write on the day, and that's what we wrote.
Exactly. And I knew when I did the past...
It's law of diminishing returns.
Exactly. When I did the actual ANSCA past papers, and this was, the really old ones, there was 10 to 15 questions. So 10% of questions we couldn't agree on. And just accept that. Don't waste your time.
You can't spend 3 hours on each of those, right?
Exactly.
You've got other content to cover.
The one thing that you have to do the first time you go through, you have to reference things, because when you're having a discussion, wasting time referencing the second time round is the worst waste of time. So do it once, do it right.
And all of my notes in OneNote have the references from where the information came from.
Oh, amazing.
That was something I regretted not doing in the first part.
Yeah, exactly, same thing. Let's move on to Vivas. So how did you prepare for Vivas?
Do Vivas, do more Vivas. When you think you've done enough Vivas, do more Vivas.
Excellent. And that's the end of the podcast.
So I will confess that in the first few weeks, I emailed consultants that I, felt more comfortable with. And then moving on towards the end, I would email consultants that I actually was a bit intimidated by, because that would, sort of simulate the exam environment to a degree, right? And then just aim to do as many Vivas as you possibly can. When you do the Viva, log in your OneNote or wherever it is that you're recording what the Viva was on, what you think you did well, what you could improve, some key learnings from it, some key feedback. And even if you get to the point where you've done, 70, 80 Vivas and there's nothing that, you particularly learned in that Viva, just write, this was a good Viva. This was the topic, and then move on. So you've got a log of how many you're doing, because you'll probably feel like you've done 200 when you've done 50. But, I think you've got to do a little bit more than that. I think at least 80.
Like to do 1 to 2 per day somehow is good. And you might not get a consultant, but just remember, you're in your study group.
Exactly.
Someone's had a Viva there. Your goal is to give your Viva to everyone you know, and them to do the same to you.
And that'll help, because you're getting more Vivas from your study mates, but it'll also help you to give Vivas to know, oh gosh, they gave such a long preamble. It was so annoying. Oh, that's probably how the examiner felt when I gave a really, really long preamble. I just want them to get to the point. And so you'll learn something from giving Vivas as well.
Obviously look at the Viva Bootcamp videos, because they'll have lots of information about this. You mentioned, practice key statements, practice troubleshooting, and practicing all these things, because, especially when we run the SIMG course, but it applies to everyone. If you haven't rehearsed saying things, it's just hard.
Yeah, there's sort of an ANSCA way to answer the Vivas, isn't there? Yeah, and I think I really picked up a lot of that from your bootcamp series. So plug for the bootcamp series. But something you really got us to do just over and over again is, the patient's bradycardic. What's your, what are you going to do? The patient's got high OA pressures. What are you going to do? And practicing those key statements so they roll off the tongue is really, really helpful. Practice describing procedures, so that you don't get caught up in be, you know,
When you share.
yeah,
Oh.
just so that you can get through things quickly.
That's right.
Yeah.
And if you record yourself and see how long it gets you to get to the point of something, like how do you do super card block? You know, IV consent, you know, monitoring assistance drops equipment, let's position the patient, and I do this, you know,
Yes.
to be able to just get through any of the usual
Versus
stuff.
in an anesthetically safe environment with you know, with a trained assistant, I would place an IV in the cubital. Like that's all extraneous information. But just as you said it there, you know, practicing describing that technique, because you'll be asked to describe some kind of procedure in the Vivas.
And just a plug for the fact that this exam is so real, if you do it systematically and efficiently here, means that when your patient desats or when you're actually doing a regional technique, you will do it like you do in the Viva because, you know, you're so efficient. And, you know, there's a difference between people who've just really rehearsed whatever they've rehearsed. You know, they'll perform better on the day. So that's a plug for just taking care of your patients really well as well. Yeah. So like you said, write and give Vivas. Like, what do you think the extra advantage of giving the Vivas is?
So I think writing Vivas is really helpful as a way of practicing, you know, the structure of the Viva, the fact that there's usually a crisis phase, all of that kind of thing. And then you know the sort of anatomy of a Viva. And then giving the Viva, you might find, oh, that person described that really well. I'm actually going to steal that technique. Or that it took them 2 minutes to get to the point. I felt really frustrated. The examiner probably feels really frustrated. I'm going to, you know, practice getting to the point faster. And the more you do this, I think there's the slicker you get. And part of the Viva is, sure, assessing your knowledge, but the other part of it is how do you move through the questions quickly? How do you get the examiner to move you on? How do you answer as many questions as possible, getting as much information out as possible? And, you know, getting towards the end of the Viva versus, you know, sitting, you know, in the early part of the Viva and just not getting as many marks.
Amazing. You've got some techniques, strategies here as well.
Yeah, be interruptible. You know, examiners, I believe, do interrupt you if you're, you know, got to the point where you're not getting any more marks. But obviously, if it's harder to interrupt you, you know, they're human. To that end, give the answer, then give the rationale. So if someone said, you know, what are the causes of, well, you know, what are you going to do in this situation? Say what you're going to do, pause, look at the examiner to be interruptible, and then give the rationale. Because if you say the answer first, they may just move you on to the next question, in which case, great, you've got the marks for that and you're getting the marks for the next question.
You haven't wasted time.
Wasted time going, oh, you know, I would assess this, I would assess that. And the examiner's going, yeah, but what would you do?
Yeah, excellent. You talked about having a structure, so staying high. There is a tension between structure and answering the question. What do you think of that?
I think it depends on the question.
Yeah, totally.
It's really hard to give a blanket rule for that.
So I think there's specific questions. So, what's the drug you're going to give, or what's the dose of this? Obviously, just give the dose. But you'll find that a lot of the stems are large now with very broad questions. You have to give a complete answer, like we were talking about with the SAQs, and to have that structure but not going to the usual points and go, that's what I care about logistics, because this is an after hours case and I need to call in this ENT specialist or whatever it is. Those are the important things, not just I have to have theatre ready, which you absolutely do.
I guess like the common question of how would you transport this patient? I think, saying, giving all the detail of the position statement on transport of the critically unwell patient is probably not the answer to that question. It's something like, I transport the patient according to the ANSCA position statement on transport of the critically unwell patient, which includes personnel considerations, equipment considerations, drug considerations, and route considerations and pre-notification ahead. And then pause and look at the examiner. If they want to know that, you need 3 people and blah, 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 then they won't ask you the next question.
That's right.
But if they go, yep, that's fine, then you'll move on.
Beautiful.
Does that sort of answer the headings question? Detail?
Exactly. So on the day, how did you prepare for the day?
So the 2 days of the process, or the 3 days that I was in Brisbane, felt like I was on an adrenaline infusion the whole time.
Nice.
There's logistics around, have your outfit picked out, you want to be well presented and all of that. Mine was interstate, so I chose an accommodation that was basically next to where I needed to be, because, the last thing you want is to order an Uber and the car breaks down on the way there or something like that. If it's in your state, plan how you're going to get there.
I did the drive-by beforehand. So I go, there's parking, there it is, and I could visualize it. So having that, like I need a study break, might as well drive by and go, this is what I'm going to do. There's my parking spot. There's whatever.
So I have to confess, when I sat the written, which was, in the city that I live in.
Yeah.
I stayed in the hotel next to it the night before because I was like, look, it's just stress that I don't need.
Yeah.
You know,
That's not the craziest thing.
that's not the craziest thing.
Probably worth the money to,
Yeah.
make sure you got there.
Versus, it's the $6,000 of resitting the exam.
Yeah. Especially if you live far away. Like, yeah. Absolutely.
And also it was just in an area that I know the traffic at that time of the morning is absolutely deplorable, and getting in there was going to be difficult. So,
balance that with what do you need to sleep well, and I know I don't sleep well with hotel beds because they're always too soft.
Oh, okay.
But
I also knew that I wouldn't sleep well if I was constantly like, oh, is it?
Yeah, that's right.
Whereas I just basically walked out of bed and was in the exam center. So do what works for you.
Anything else with logistics?
Kind of know how the day's going to run, right? So I had my med vivas the day before my anaesthetic vivas. So I knew that I was going to go in at X time. There was probably going to be a wait room. The logistics of they give you a little card that has your candidate number on it. And then you're going to go into the exam and afterwards. The anaesthetic vivas are 4 in the morning, 4 in the afternoon. Have an idea of, I think, what you're going to do in the interim, in the intervening time, especially if, it's in your state. And so you're just going to be sitting around the exam centre around other anxious people. They're going to be dissecting the viva. Or did you answer this? Did you answer that? That was never the right thing to do. You need to be, doing the debrief, especially when you've got 4 more to sit.
There's nothing to be gained by that.
No, absolutely not.
What we did was we went, they haven't given us trauma and obstetrics and neuro, we might get that. And we did.
Yeah.
So preparing for the next 4 and just, thinking about things, talking through things, I think that was really good to use for me and my mates who were happy to have a chat.
Yeah, I did that as well, but by myself with my study notes.
Yeah, excellent.
Because you will get an airway, a peds, an obstetrics, and a trauma.
Beautiful. Look, I think that's all we need to go to. We're probably running out of time as well. Yeah. Just to plug a real massive thanks to Meg. Thank you so much. And thanks for all the help all the stuff you give to ABC's Anesthesia is just amazing. Just want to, massive thanks to you. And just a plug for the final exam course. It's on anesthesia.thinkific.com. And you'll see the Anesthesia final exam course has all the videos of recordings of all the various things, all the structures, all the frameworks that I've put up there, but also the most recent, Viva boot camps, final exam courses, the med Viva session, the investigations, chest x-rays, ECGs, for example, will get up there, and lots of real Vivas. And we've got a new series coming up where I'm going to talk with Dr. Viva, one of the ex-chair of the examiners for the final exam. We're just going to go through and construct the last year's Vivas and give it to each other, which is a lot of fun. Yeah. Meg, you might be into that too.
Sounds like fun.
Sounds like fun. Thanks everyone for watching and listening. We'll see you again next time. Cheers. Now, what's new with ABCs of Anesthesia is that we're forming a whole bunch of very comprehensive courses for every stage of your anesthetic journey, from medical student to procedural skills, from foundations in anesthesia, as well as really important exam lectures and clinical anesthesia courses as well.